Why does the word cancer evoke so much fear? And because many people believe that cancer is incurable, although it is curable in many cases. People believe that the treatment is very unpleasant or painful, and people believe that the treatment would be very expensive, not affordable at all. For most patients, they can't afford the costly treatment. Yet there is a very common tablet found in every home. It is in your home. Even if you don't have a cancer patient, the tablet is in your home. Every person keeps a strip of this tablet. The cheapest, ubiquitous, most common tablet over the counter. You don't even need a doctor's prescription. Whenever you travel, you take that tablet as a precaution. So this common tablet, the cost is less than rupees 2 or rupees 3 per tablet, the cheapest one. And this tablet could be the anti-cancer weapon of the future. This tablet, either alone or along with other therapies, could prove to be a potent anti-cancer weapon of the future, encouraging research on colorectal and other cancers. We will see what this common tablet, the most inexpensive, the cheap tablet which you always carry about, which you always keep at home, how does it work to prevent or to slow down the growth of cancer? And let us see the new research on the emerging future treatment of cancers. Can you identify the drug? It is widely used to reduce pain, fever and inflammation. It is not paracetamol. It is not paracetamol. It's widely used to reduce pain, fever and inflammation. You can see the structure and guess what the tablet is. If still you can't, here we give you the name. It may help to prevent or slow down certain types of cancer by controlling the tumor growth. The acetyl salicylic acid or aspirin. Now you may ask, if aspirin can control cancer, why not paracetamol? We will see the difference between the work of aspirin and the work of paracetamol, why paracetamol is not effective but aspirin is effective. So here we study the differences between aspirin and paracetamol. Aspirin is antipyretic, analgesic and anti-inflammatory. Antipyretic means reduces fever, analgesic reduces pain and anti-inflammatory reduces swelling or inflammation. Paracetamol is antipyretic, reduces fever, analgesic reduces pain, but it is not anti-inflammatory. The anti-inflammatory property of paracetamol is almost zero. Aspirin has three properties: antipyretic, analgesic and anti-inflammatory. It can control fever, pain and inflammation. Paracetamol has only two of these properties. It can reduce fever, it can reduce pain, but it has minimal effect on inflammation. It is not anti-inflammatory. That's the reason why we are using aspirin and not paracetamol to control cancer tumors. As with all public awareness videos, we caution you that while some success has been reported in limited research, it's not as yet a proven cancer cure. But it could be in future. It could be in future, but it is not yet a 100% proven cancer cure, although there has been success in some limited research. Future, there is hope, but no one can be sure about what exactly, up to what extent aspirin will prove to be working against cancer. Do not self-medicate. Research is still going on. The video is for public awareness only and not a substitute for professional medical care. We do not encourage, either in this video or similar other videos, to go to the chemist shop and buy some medicine. No. These are for public awareness. But whenever you have a problem, the final verdict, the final advice should be given by a doctor or by your clinic or by your hospital. So whatever your hospital or doctor says, that's final. Videos are not substitutes for professional medical care. But there is hope that this cheap tablet, aspirin, or the water soluble form, it dissolves in water, so dispirin, this could prove to be a cancer cure in the future. Besides pain, fever, inflammation, in many cases, the three are interrelated. Inflammation might give rise to pain and fever. Aspirin in low doses is also used for some heart patients. Not only for pain, fever and inflammation, low dose aspirin like 75 mg to 100 mg is used for some heart patients. Aspirin in low doses reduces the risk of blood clot formation inside blood vessels. Aspirin is a cheap and safe drug that acts as what we call blood thinner, dilutes the blood so that the blood does not clot inside your blood vessel. Blood should clot only when there is a cut, when there is bleeding. But while inside your body, blood should not clot. So if there is a tendency that blood might clot inside your blood vessels, then blood thinner is given, and aspirin is one of the cheap and safe drug that acts as a blood thinner. All the persons taking regular aspirin may suffer excess bleeding due to delayed blood clotting, but here we are investigating the cancer curing property or tumor attacking property of aspirin, particularly in colorectal cancer. What is a possible relation between aspirin and cancer? How does aspirin actually act against cancer tumor? We know that long-lasting inflammation increases the risk in some cancers. Inflammation, long-lasting, could be increasing the risk of cancer in some people. Because aspirin reduces inflammation, it could also retard or slow down tumor growth and cancer development. We will investigate the specific mechanism in this regard, but reducing inflammation and controlling inflammation could be one pathway by which aspirin slows down or retards cancer. Let us have a brief insight into the mechanism of aspirin effect on colorectal cancer. You can see in the picture how colorectal cancer is influenced by aspirin. Aspirin tends to slow down the growth and development of colorectal cancer tumors. We have shown it symbolically how aspirin might prove effective and has proven effective. In some cases, aspirin has actually shown that it is effective in either controlling or slowing down the tumor growth in colorectal cancer. So, special aspirin studies in colorectal cancer. First of all, we can see that what is the meaning of colorectal? You can see in this picture, this is the food tube. There is a food tube. After stomach, you have got the small intestine and then large intestine, and the large intestine, at the end of the large intestine, you have colon, rectum and anus. So this is what we mean by colon and rectum. The end part the last part of your food tube or digestive tube. And you can see how reducing inflammation actually means controlling the tumor growth in colorectal cancer, and this could also be true in case of other cancers. So aspirin is really a wonderful future hope that cancer treatment could be cheap, cancer treatment could be simple and not so unpleasant or painful, and within the reach of every person, because aspirin or dispirin is a very cheap tablet. So it really holds the future hope, but more research needed. But if it succeeds, then it could be a revolution in cancer treatment. Now here we have got specific mechanism by which aspirin influences cancer growth, or rather retards, slows down cancer growth or controls cancer growth. First is immunosurveillance. Studies demonstrate that regular aspirin use increases the expression of CD80 protein on certain immune cells. This enhances their ability to alert the immune system to recognize and attack tumor antigens at an early stage. So your body starts fighting with cancer much earlier, before it goes out of hand. So immunosurveillance improved the expression of CD80 protein, so your body recognizes cancer tumors and starts fighting with the cancer tumors much early in the preliminary stage, rather than waiting for it to go to advanced stage. The second mechanism, cell cycle arrest. Proteomic research shows aspirin can upregulate tumor suppressor proteins. It can actually increase the activity of tumor suppressing proteins like p53, while downregulating others like CDK1, effectively inducing G1S cell cycle arrest in colorectal cancer cells. So what you are doing? You are increasing the activity of tumor suppressing proteins, and you are controlling or downregulating or putting down other proteins, so that the cell cycle arrest in colorectal cancer cells is more effective. The third is biomarker. Clinical studies, trials on ALASCCA protocol indicate that patients with this gene mutated tumors who take low dose aspirin experience a significantly lower risk of cancer recurrence. Cancer recurring after it is cured or controlled, returning, that is significantly lower with low dose aspirin or low dose dispirin. The risk of cancer recurrence, not occurrence, recurrence means returning after it is controlled. The cancer returning, the possibility is much reduced because of these biomarkers, which are gene mutated tumors. So with low dose aspirin, the return of cancer could be minimized. Preventive benefits. Now these are preventive. Means people who are at high risk, they are at very high risk, they might suffer from cancer, but at present they are non-cancer patients, but they are in high risk group. Preventive. Secondary analysis of cardiovascular trials establish that regular prolonged aspirin intake over 5 or more years seem to decrease overall colorectal cancer incidence. Those who are taking aspirin or dispirin for 5 years or more than that, they have decreased incidence of colorectal cancer. So even among the high risk patients, the possibility of cancer could be reduced if they are taking dispirin or aspirin over prolonged periods of 5 or more years. Preventive benefits. You are preventing cancer in many persons by giving low dose aspirin for long duration. Now here are other mechanisms inhibiting COX enzymes. Aspirin blocks COX-1 and COX-2 enzymes, which reduces the production of prostaglandins, which are known to trigger inflammation and promote tumor formation in the colon. So your tumor formation can be controlled by controlling COX-1 and COX-2 and indirectly controlling prostaglandins. Blocking platelet aggregation. By stopping platelets from clumping together, forming clumps, aggregation. Aspirin prevents platelets from releasing growth factors that cancer cells use to multiply and spread. Metastasis, spreading of cancer from one region to another region. Promoting immune activity. Aspirin increases the number of immune cells infiltrating into tumors. How many immune cells? How many cells that actually fight the cancer cells? How many of them will actually enter the tumor and fight the cancer cells? That number could be increased by aspirin. So if more number of cells, that's fighter we call it, more number of warriors and fighters, if they could enter the tumor, then they would be fighting the cancer. And they could enable the body's natural defenses to better target and kill cancer cells. Your own immune system, your own body has fighters and warriors, but how many of the warriors actually reach the tumor or infiltrate the tumor, go inside the tumor and actually fight and kill the cancer cells? That could be improved by low dose aspirin taken over prolonged periods. So aspirin possessing anti-cancer properties may not mean that aspirins can cure the cancer. It could mean that a regular aspirin intake in low doses may reduce the risk of colorectal cancers or other cancers. Aspirin may be a supporting therapy alongside the conventional ones. It does not mean that only aspirin will cure the cancer. It could mean that it could be used as a preventive to reduce the risk, or it could be an adjuvant along with conventional therapies to control the cancer. So it would be easier. You will need lower doses of chemotherapy or radiation. So aspirin may not be the sole drug, but it could be helping other drugs to control cancer or to minimize the risk of cancer as a preventive. And lastly, stay informed, stay careful, and trust evidence-based medicine only. Never trust miracle cure claims. Miracles do not happen. If people are claiming miracles, they are frauds, not science. Trust your doctor, trust your hospital. Do not trust the con man. Do not trust the astrologer. Do not trust the religious babas. Only trust your doctor, trust your hospital. Your doctor, your hospital, only they can perform the correct diagnosis and treatment. So stay informed, stay careful, and do not trust in miracles or frauds.